Hi, I'm Dr. Adrienne Silver, and I am both the Director of Medical Education for KP Santa Rosa, as well as the Rotation Director for Outpatient Pediatrics. I'd like to take a second to tell you what it's like to be a family medicine resident here. We've had a rich tradition of medical education here in Santa Rosa, with established residencies in optometry, pediatry, and pharmacy. 3 years ago, we made the leap to establish our own family medicine residency, confident with the knowledge that we have an amazing, engaged faculty that we're eager to share what we consider to be the right way to practice medicine. We use technology to make a physician's practice better and connect with each other and our patients. We utilize our strong, evidence-based, integrated health system to provide the best care possible. In these last few years, our family medicine residents have woven themselves throughout our faculty. And it's hard to remember a time when we didn't have residents. Our first few years of pioneering residents have set a strong standard of excellence in their work ethic and commitment to learning to be the best doctors that they can be. They have become a vital presence throughout our campus, from labor and delivery, through pediatrics, adolescent medicine, internal medicine, surgery, and subspecialties. All medical specialists are a phone call away or often a walk down the hall, and close relationships are formed with specialists, expanding the confidence of primary care providers to manage complex patients. For those that like to teach, we have a rich relationship with several medical schools nearby, including UCSF, UC Davis, and Touro University. We are also part of a large cohort of medical schools concerned about health equity and looking to attract students and residents interested in practicing in underserved communities. Our facility is within Santa Rosa, which is a small, strong, and vibrant city, and our residency has enmeshed itself within the community and within community health centers throughout the area. This year, a main focus of all of Kaiser Northern California is on joy and meaning in medicine. In Santa Rosa, we have embraced the importance of work-life balance. We truly care about each other and support our colleagues both personally and professionally. I may be a bit biased, but I happen to think that we have the best pediatric experience around. We have 3 different pediatric facilities with a total of 21 pediatric providers eager to share their knowledge and love of kids with you. Our hospital has a very busy labor and delivery, and consequently a busy newborn service that will give you lots of opportunity to establish a strong panel of pediatric patients. The inpatient ward is busy, mostly with bread and butter peds with a sprinkling of more challenging cases that we take on rather than transferring to Oakland. Your rotation at KP Santa Rosa is unique from other programs. Instead of a month of all inpatient and a month of all outpatient pediatrics, you will do 2 months of inpatient peds in the morning and outpatient in the afternoon. This way, your experience isn't dependent on what time of year that you do your rotation, and you will get well-versed and comfortable with both inpatient and outpatient pediatrics. In your second and third years, you'll be mostly in the outpatient facilities, augmented with experiences in child psych, pediatric dermatology, endocrinology, lactation, and peds urgent care. In our main facility, we have a 7-bed treatment room run by pediatricians and pediatric-trained ED nurses, meaning you'll get extra experience managing sicker kids beyond your ED rotations. In your second year, you'll travel to Walnut Creek, which has a very robust inpatient pediatric facility and ED, and spend 2 weeks strengthening your pediatric skill set. Throughout all 3 years, you'll work with neonatal nurse practitioners and lactation specialists to hone your care of newborns. Finally, you'll learn from world-class pediatric specialists in Oakland. By the end of your 3 years, we feel confident that you will be comfortable managing neonates through adolescence, both well and sick. We are sorry that we can't meet you in person and show you what a special training environment that we have created. I hope this video gives you a sense of Kaiser Santa Rosa. We are proud of what we've built here and excited to add motivated, caring, and special residents to our program. And by the way, if all of this info didn't sway you, we live in one of the most beautiful places in the world. If you love to hike, bike, hang out at the beach, drink world-class wine and beer, and eat amazing food, this is the place for you. Thank you for listening.